renal failure or kidney failure is generally considered an end to the human life. But with the advancement in technology and the way the kidney has been treated over the years, the things have changed. The outcome of the treatment has improved. What are these changes? To discuss these changes, today I am here with Dr. A.K. Singh, an eminent nephrologist with an experience of more than 15 years. He has been the head of nephrology unit at various hospitals, and I will be today discussing what these changes in kidney treatment are.
Last 15 years, the kidney disease treatment has improved a lot. From advancement in the hemodialysis machines, new generations of the dialyzers, and continuous ambulatory peritoneal dialysis totally changed the way we treat patients. 15 years back, life expectancy of a renal failure patient is around 1 or 2 years or maximum 3 years. But now, the people are very commonly lives 10 years, 15 years on even dialysis, regular maintenance hemodialysis. And with transplant, the life expectancy is more. Previously, transplant failure is quite common because of inadequate medication of the immunosuppressive therapy. But now, the new advancement in the immunosuppressive therapy has given a new hope to renal transplant patients. Most important aspect of kidney failure management is a human touch, a ray of hope for these patients. And if they got something, if they can live, they can survive, they can prolong their life with the quality, that is the most important. And being a good human being, a human touch to our patient is most important aspect, because we are treating human, not robots. Second, most important aspect is advancement in the medical therapy. The new generation of the therapies are the basically helping the body to recoup as normal as anybody else, anybody as a healthy as the renal failure patient. They can lead to a good quality life, and quality of the life is most important aspect in the renal failure patients. Most important aspect of treating renal patient in this hospital is the comprehensive medical care of all super specialties under one roof. And in our hemodialysis setup, we are providing intensive care hemodialysis, and that is a rarity nowadays, but with the help of the Metro Group, we are providing round the clock 24-hour hemodialysis services at a very affordable and low cost, because in India cost is still very important in the long-term chronic illness like kidney. We are doing around 200 to 300 hemodialysis per month. Kidney failure is basically a silent illness. A lot of symptoms are not particularly specific to the kidney failure, but few are like edema, swelling over face and lower limbs, decreased urine output, infections, appetite, nausea, vomiting. These are the symptoms which are suggestive of many symptoms, but they may be attributed to the kidney failure. Because kidney disease is basically it is a silent killer, so the early preventive health checkups will help in diagnosis the early renal failures, and those patients who are above 40, those who are suffering from hypertension, diabetic, and being in India, the diabetic capital of the world, the diabetic nephropathy and diabetic renal failure is a very common. And those who are having history of renal stones and the family history of renal failure, they should be more aware and they should reach early to the nephrologist for prevention of kidney disease.
For the insight that you have provided to our viewers, and I hope that you will keep up the work and keep helping the patients throughout kidney failure. Thank you.
Thank you very much.